Hi, and thank you for joining the Healthful Roots podcast. This is Dr. Victoria Andarcia, and today is going to be a little bit of a hormone rant just because of certain things that I've heard in my clinic this week that I just wanted to clarify. I think that I have been living in a bubble when it comes to hormone health. So, I'm not very active on my social media or on my podcast. I do talk about hormones, but I don't really get like crazy about it. I have very different topics that we cover because in my bubble, these hormone issues or hormones concerns are almost irrelevant. But then over the last couple of weeks, I have been hearing things in my clinic and I felt it was just maybe a good time to clarify the good and bad of hormones. Are they good? Are they bad? So I'm going to start with vaginal estrogen because I had a patient who has a history of uterine and ovarian cancer come in absolutely petrified to use estradiol, vaginal estrogen, which is fair, valid. I understand the fear, I understand the concern, and some oncologists would also still be hesitant to use it, even though the FDA recently, I think it was last month, removed the warning label that vaginal estrogen caused cancer. Because when you're using vaginal estrogen, it's at very low doses and you get very little, if any, into your systemic circulation. It's just there to help rejuvenate the vaginal tissue because your vaginal area has estrogen receptors and testosterone receptors. So we need vaginal estrogen. You can start in perimenopause or as soon as you start having vaginal dryness. You do not need to have menopause or be in menopause for needing that. And so, one of the biggest things that is used to treat is what we call genital urinary syndrome of menopause, which can include vaginal dryness, can be which can lead to painful sex, increases your risk of UTIs. And listening to a podcast with, I can't remember her name. I can't remember her name. But she was talking about it was Dr. Rachel Rubin. She was talking about how the government could save billions of dollars every year if we just put all women on vaginal estrogen when it was necessary. It would save Medicare anywhere between 6 to 22 billion a year due to reduced costs associated with preventing UTIs and other complications in menopausal women. So, when taking any medication, whether it's hormones or not, you have to assess the benefits versus the risks. And in this case, I would say that the benefits are a lot higher, but also about quality of life. I have so many women who come in and they're not, having sex with their partners because it's too painful, but also it's uncomfortable because it can cause frequent urination as well, which is obviously annoying, can lead to some incontinence, which gets better when you're treating it with a vaginal estrogen. Okay, so just that vaginal estrogen is safe. Okay, so that's one of the things that I've heard recently that I just wanted to clarify. Then the other thing, had a woman come in and sit down with me, and she was absolutely petrified of hormones. And she was started on a very, very, very low dose of topical estrogen. It was a bias cream, which I wouldn't typically prescribe, but her provider had prescribed this to her. And then she was on a low dose progesterone. She seemed to be doing fine on the progesterone, but every time that she applied the estrogen, she would get into like this panic mode. She said she couldn't breathe, her throat was hurting. I mean, unusual side effect can happen, I guess, but it's an unusual side effect to the point where she would apply it while sitting in the parking lot by the ER because she was worried something was going to happen. Now, going to be her estrogen? Maybe. I'm not going to rule that out, but it's unlikely. But when she sat in front of me, she said, my doctor said I should start this, but it's just like hormones are really bad for you, aren't they? And she was like panicked, and the anxiety was like radiating off of her body. And I was like, okay, this is probably already a very, very anxious person at baseline who was given hormones and probably not a really long conversation around hormones and the risks and benefits for her. Mind you, what's interesting is that she came in with what I suspect is frozen shoulder. She could barely move her left shoulder. She was crying because she couldn't work out, and working out is her outlet. And frozen shoulder is one of the symptoms that you get when you have low estrogen. Okay, so for her shoulder, in the meantime, while I'm having her read The Menopause Moment by Kelly Casperson, because it's very evidence based and she has a lot of resources in the back that discuss why hormones are not dangerous, um, we're using peptides. One injection of the peptides, and she was already feeling significantly better. So her shoulder was feeling significantly better. So this is not a torn rotator cuff or anything crazy like that if it gets better with one injection of peptides. I think the estrogen will be very beneficial for this patient once she reads all the data on why hormones are safe, especially at her age. She's still within the 10-year period of when she had her last menstrual cycle. So, yes, I could have talked to her about this in my clinic, but sometimes when someone's super anxious, I think they need to read it, they need to absorb the information, they need to be able to look up the research on their own, because the words coming out of my mouth would probably not have reached her with the level of anxiety that she was experiencing in my clinic that day. So, speaking of that, there's another thing that I've heard in my clinic, which is my doctor says I need to come off of hormone therapy because I'm past the age where I need it. This is absolutely false. There is no age to come off of hormones. You can take hormones as long as you feel that it is giving you the benefit that you need. So that is false. And actually, when you take someone off of hormones, what will happen is that their bone health deteriorates, their muscle strength or their muscle retention will also dwindle. You are increasing the risk of cardiovascular disease because estrogen is known to be protective. And if you look at the research from Lisa Mosconi, the benefits of hormone replacement on brain health are pretty significant. So we're potentially taking that away, because how many women have I had in my clinic who come in and they're like, oh, I don't feel like myself. I have brain fog. I have trouble with word finding. I'm forgetting things. And then you put them on hormones and all of a sudden they're like, oh, I'm back. Right. So I don't think that we can really ignore the cognitive benefits of being on hormones. So no, I would not take it off. I would tell the patient, obviously it's up to each individual patient. The decisions that I make around hormones with my patients is a decision that we make together, but ultimately it's their decision. So if someone said, I want to come off of hormones, I'm not going to try to stop them, but I don't think that that's something that you have to do just because of your age or because you quote unquote don't need them anymore. I would never recommend that myself. So that's another thing that is absolutely false. And then the other thing that is false is I missed my window, right? Obviously, well, maybe not obviously. So the studies that they did on hormone replacement showed the most benefits within the 10 years after your last period. And the reason why is because hormones, specifically estrogen and then testosterone, I guess, um, are better at preventing disease than treating disease that you actually have. So starting hormone therapy within the first 10 years before, or I mean, after your last period, has the most benefit because you haven't really developed the chronic diseases that are associated with having a really low hormone state. After those 10 years, you may have had developed some, coronary calcification that you might not be aware of because you don't feel that just happens. You might have some development of amyloid plaques, which can lead to dementia. You might have had muscle loss, which, unless it's significant, maybe you don't really notice. And also, you probably have developed osteoporosis or osteopenia because you haven't had hormones for your bone health, which you also don't feel, right? But, anyways, these things have happened, and maybe you won't feel the benefits as strongly as someone who started it earlier for prevention, but it can still be helpful to prevent deterioration, like further deterioration of your bone and your muscle strength. And I did read the study that I don't have it, but maybe I'll link it because I left it in the office. But it was an interesting study where they gave testosterone to women who had pretty significant congestive heart failure. And, what we've been hearing is that hormones, testosterone, or whatever is so bad for your heart. That's also been removed. That warning has been removed from the testosterone label, even for the ones that we use in men, because that's not true. But what they noted in the study is that the women who were given testosterone therapy with CHF had improvement in their VO2 max, right? Their oxygen carrying capacity, or their body's ability to use the oxygen. They had an improvement in their 6-minute walk test, which is their ability to get up and just walk faster, and overall sense of well-being in women who had congestive heart failure. So I think that in people who are even chronically ill, is my point, if they don't have risk factors that would impact you starting or prevent you from starting the hormones, it can be beneficial in that group too. Okay, so then what are like the side effects? Any medication and any supplement can have side effects. And that's something that I find like crazy, is that some people are like, well, I want to do this naturally or whatever. Even if you are taking supplements, which are quote unquote natural, that still has potential side effects. But also, what is more natural than biosimilar or bioidentical hormones? It's like mimicking what your body makes, right? So that is, in my opinion, also considered a natural form to deal with your symptoms of menopause. Maybe it's an unpopular opinion, but it's my opinion. Okay, so where was I going with this? Symptoms. Okay, any medication, any supplement that you take can have the potential for side effects. Now, the most common for testosterone, and I mean estrogen too, is water retention. You can get spotting, kind of mimicking a period. You can get hair loss, but the hair loss I've seen with testosterone mostly happens with pellets or if you're on a high dose of testosterone. It could happen if you're predisposed to hair loss as well, but it does happen with the higher doses. Acne. I mean, those are the ones I commonly see with progesterone. Not everyone tolerates progesterone. It's very good for sleep, but some women say they feel like a zombie or they just fall asleep immediately, but they're groggy the next day. In a small subset of women, and I actually finally saw one recently after 3 years of doing this or 4 years of doing this, is anger. It can make you angry, which is interesting. Not sure why, but that's the case because in most people, progesterone actually mellows you out. And bloating can be a big one with progesterone as well. So just let's note that. Um, those are the most common ones. I mean, I'm sure there's a really long list, but you can mitigate this by starting someone on a very low dose of hormones. For anybody who's worried about side effects, you start very low and go slow because there is no rush to get you to a dose that makes you feel good. You'll probably start to feel better even at the lower doses. As a provider who does pellets, myself, I have testosterone pellets, or I get the testosterone pellets, but I also do pelleting in my office. I don't rush to pellets unless you've already been on them or you're absolutely sure that that is the route that you want to go and you don't want to try anything else. I do recommend that people start with a testosterone cream, an estrogen patch, so they can see how they're going to respond to hormones. And also, you're getting some hormones in your body at a lower, lesser, like slower pace, which your body may be able to adjust to a little bit better with less side effects than automatically doing pellets, which are a higher dose, and then shocking your body into like, wow, we have hormones now. Because I think that's when you see the most side effects. And even when I do pellets, perhaps I underdose, but I tend to go slow with those as well because I would hate for someone to be turned off of hormones just because they're having a bad experience, which leads me to something else. So I saw a patient, sorry, there's dog hair on this, on my mic. There's dog hair everywhere in this house. But okay. I saw a patient yesterday and she said, well, I tried hormone therapy in 2020 and it did not work for me. Okay. Well, what kind of hormone therapy did you try? Because there are so many different ways that you can do hormones. So just because it didn't work one time doesn't mean it's never going to work. Okay. So let's talk about this. And maybe I've talked about it before, but we're just going to say it again because it's important. You have estrogen patches, estrogen creams. There is a vaginal ring that you can put in that has estrogen that is at a high enough dose that you can absorb it systemically. You have testosterone cream, testosterone pellets, right? Pellets for both. Um, Testosterone cream, pellets. No patches yet, hopefully soon, because I find that those are easy. You can do injections. Not my favorite route, but I have women who want to do injections, and that's fine. And then for progesterone, you can do it intravaginally with suppositories. You can do oral. I am not a fan of the cream, but if it works for you, that's great. But if you're on estrogen, that cream, that progesterone cream, is absolutely useless and it's not going to protect your uterus from the risk of uterine cancer, right? Estrogen is a proliferative, it causes cells to grow and things to grow, and you worry about that in the uterus because when cells overproliferate, your risk of uterine cancer increases, but progesterone stops that, right? That's why your body makes estrogen and progesterone together. So unless you have a hysterectomy, if you are on estrogen, I don't want to see you on the progesterone cream. You need to be on either the vaginal progesterone or the oral progesterone. And if you do not tolerate progesterone, which can happen, there are other medications that you can take that help with your hormone symptoms that do not include being on progesterone. And that's another topic, and it would probably take a while for me to explain because also some people are like, no, but that's not bioidentical hormones, and it would just be a thing. Why don't go first line for the conjugated equine estrogen, which is not quote unquote bioidentical or biosimilar? But that doesn't mean that you can't use it. And actually, when they did the WHI studies, there were no real adverse effects from using estrogen. The adverse effects came from the progestins, which are synthetic progesterone. So, if someone does not tolerate progesterone or does not tolerate the bioidentical estrogen for whatever reason, there are medications with the conjugated equine estrogen, CEE, that can be helpful for your symptoms. So now that is to say, there are multiple options. Not everyone is the same. I have people who don't absorb the cream who do better on the pellets. I have people who don't tolerate the pellets who do great on the patches. Like, hormone therapy is a little bit of trial and error. It's a little bit of an art, and you have to go to someone who knows what they're doing. Not everyone who says that they're a hormone expert is a hormone expert. I would ask them, where did you learn how to do hormones? Has this been trial and error? Because we didn't learn this in residency. I've taken multiple courses. I have read multiple books. I just got certified as a menopause certified practitioner or provider, which you can go on the Menopause Society website and verify. And you can also find other Menopause Society providers to see who in your area can do hormones in a way that is appropriate because not everyone knows what they're doing. Sorry, just because they say that they're a hormone expert or they're a hormone provider, I have rolled my eyes at some of the things I have seen people come in on. And that doesn't mean that I am better or whatever than the other people who are providing it, but the women are coming to me because that hormone therapy didn't work, right? So I would just say, choose wisely, go to someone who will listen to you, and do not be turned off from hormone therapy because there are amazing benefits. Not only does it help with mood, but it's going to keep you active longer because it's going to help prevent osteoporosis and muscle loss, which is critical as we age to maintain your muscle strength and your bone strength. a fracture, an osteoporotic fracture, can lead you in a nursing home. Okay, it's not something to be taken lightly. It can help with decreasing your risk of cardiovascular disease, decreasing your risk of dementia, and it will just keep us independent for longer, right? I don't want to have a long lifespan if I have a very short health span. I want to be as healthy as possible for as long as possible, as independent as I can be for as long as possible. And I'm sure that everybody wants that, right? So, this is my hormone rant just based off of the patients that I've seen this week. If you have any questions, you can DM me on Instagram. Just follow me at Dr. Victoria Andarcia, and I would be happy to answer any hormone questions that pop up. Thanks for listening.